Welcome to another clinical case review where I go over a case of a patient that I had and with upper cervical chiropractic care and how it was able to help this person out and provide a dramatic change for this person's life for the better. This particular case is going to be a POTS dysautonomia case that I've been managing for a couple years now, and how care has gone for this individual, what her symptom presentation was, what her life was like before and after care, and really how upper cervical chiropractic can have a significant impact on people with suffering from POTS. So this person, she came to me. She was a student in physical therapy school, and she had actually been under upper cervical care for several months now, but from what she was telling me, she had been suffering with POTS for a greater than 10 years, pretty much her whole life. She has Ehlers-Danlos syndrome, which is a connective tissue disorder, which causes a lot of ligament laxity. So a lot of people who are double jointed or are able to like really extend their elbows or knees out, they have ligament laxity, and that can cause a lot of systemic problems because nothing in their body is able to stabilize. And in her particular case, her upper neck had a really tough time stabilizing. In particular, the top two bones of her neck, the C1, C2, which is what upper cervical specializes in. So in her case, the main thing that she was experiencing was a lot of dizziness, fatigue, a lot of neck pain too, associated with this, palpitation, so heart racing, headaches, some facial numbness, and some hearing issues as well. She also had a lot of lower back issues, digestive issues like nausea, vomiting. She would be hospitalized often due to neck pain, due to nausea, vomiting, due to headaches. She also had anxiousness involved, which it's really hard to not have anxiety when you have these kind of health problems because you don't know when a flare is going to happen. And that can be super worrisome for people, patients, just because it's hard for you to go out and do anything when you don't know if a flare is going to occur. And that can cause a lot of worry. Absolutely. So in her case, she had a really tough time of working and going through school because as physical therapy, she was involved in like nursing homes and geriatric, and she had to help lift people up out of gurneys or through different exercise that are doing at PT, and all that additional weight was a huge physical stressor for her that had a pretty negative impact on her body, a body's ability to be able to stabilize the top two bones of the neck. And in prior videos, I've explained this, but these top two bones in the neck, they house a very, very important area in our body called our brainstem. I'd argue it's the most important organ in the body because nothing works without the brainstem. It's essentially, it is the regulator between the generator of our brain and the wires, our nerves of our body. The generator is our brainstem. It's what modulates, or the modulator is our brainstem. It's what modulates all of the energy and capacity being created from our brain and is able to appropriate all of the electricity through to our nerves. It also houses all the control function for our cardiovascular system, respiratory system, digestive centers, sleep centers, musculoskeletal centers, hormone centers. It regulates our immune system. It regulates everything. So the upper neck has a ton of input into our brainstem. It has the greatest influence over the function of our brainstem. And when our brainstem is not functioning well, that's when our nervous system scans, which I'll go into briefly. That's when they get a little wonky. And that is when they show signs of distress, signs of dysfunction. And that is when we know, hey, we can help this person. So this particular person, when she came to me, she was in a state that she had been better than before because she had already been under upper cervical care, but school was really wearing on her. She was having a tough time with this and she needed help. So she had all those symptoms I described, like 8 to 10 out of 10, neck pain, headaches, palpitations, dizziness, unexplained like fainting, fatigue. She had the orthostatic tachycardia, so as soon as she would lay up, her blood pressure would tank, which is also commonly a side effect of having Ehlers-Danlos syndrome, that connective tissue disorder I was describing before. And she also had all the digestive issues, nausea, vomiting, gut irritability, and leg swelling, those kind of symptoms. So when I ran nervous system test on her, which is called computerized infrared thermography, we found out that she indeed had dysfunction of her nervous system, and she was in a place where she really needed care. So when I was able to identify that, hey, we're able to help, nervous system is in a stress state, that was a big kind of like affirmation for her that it wasn't all in her head. And especially because all these doctors, and they don't know what to do, or just like you have to live with this the rest of your life. She's like, there's no way that the rest of my life can be like this. So took her through our exam process. What that scan elicits to us is that, yes, there's dysfunction of the nervous system, particularly the central nervous system, more specifically of the brain stem. And we know that that is due to a misalignment of the upper cervical spine, which is either the first bone of the neck, this one, or the second bone of the neck, this bone. Atlas versus axis. So we want to be able to figure out what is the one causing it unique to her. So we went and shot x-rays, and we found out that basically everything from right to left was not moving correctly. So top bone on the right was not moving from right to left. Second bone on the right was not translating from right to left. It also wasn't rotating from right to left. And we're able to identify that and reveal that because we take motion films. We take motion x-rays just like this, which is able to show us how the bones are moving, which is how we're able to determine how to adjust this person. What is the biomechanical issue that's causing the neurologic dysfunction? So for her, what we decided to do was take the second bone on the right around there to accommodate for the translation problem of this bone, the rotation problem of this bone, and also the top bone too. The reason why that adjustment was super critical for her, especially, I mean, not just for her, but all of POTS and Ehlers-Danlos cases, is that we want to be able to adjust you as least as possible, and we want to have your adjustments hold, which means we need the ligaments to stabilize. And with people who suffer from Ehlers-Danlos and sequentially more commonly POTS or dysautonomia, more than likely they have ligament laxity, which changes how we manage cases. We have to adjust slightly differently. The adjustment is by hand, and it is just on this bone, but in terms of how we manage frequency of adjustments, I have to be very cognizant of how often I'm adjusting, and I actually want to adjust this person least as possible. Now, with Ehlers-Danlos people and people who have POTS, they have a much more difficult time of holding their adjustment because their body is working so hard to try to stabilize everything in their body that ligament laxity is such a stressor. And when we have that ligament laxity, that can cause a lot of neurologic dysfunction because the control center for all of our organ systems are in our brain stem. So if we have ligament laxity in these upper neck bones due to Ehlers-Danlos, then we're going to have a really tough time of having this area stabilized. Thus, we're going to more than likely have a lot of stress in that area. That's going to induce a lot of stress and pressure on our brain stem, which is going to result in a lot of chaotic output, functionally speaking, to all of our organ systems downstream. Heart, lungs, thyroid, gut, you name it, the nervous system is involved. So with her, we had to be really conscious of getting her to a stable position, and she had a blend of results initially through care, just because her body, like, it's a whole new stimulus. Ehlers-Danlos people, it's a big deal. It's not something that's taken lightly for them and their systems. But over time, she responded super well, where she wasn't being hospitalized anymore. Her heat-cold intolerance had gotten a lot better. She had better resiliency through working at the PT. She graduated school, became a doctor of physical therapy, and she had much more resiliency during her day, where she was able to handle her day without having flare-ups. She was able to start hiking again. She wasn't getting she'd rarely been hospitalized over the past year, and she was just maintaining frequency and getting checked, and it really helped her get through school, get her through her first year of physical therapy, and she was able to do things that she wanted to do. And so oftentimes people who suffer from POTS, dysautonomia, Ehlers-Danlos syndrome, it's all the time. Like, there is no break. It's getting up, getting down, bending forward to put a dish away or trying to tie your shoe or pet your dog, standing back up to grab something from the fridge. I mean, it's constant, just degrading almost. Like, it's mentally exhausting, and you have to really just exist for a long time with it. And there's not a lot of options for things that can help, and upper cervical is one of the best things for people who have Ehlers-Danlos, especially because with our adjustment, there's no rotation of the head or neck. So when we adjust someone, their head is completely stabilized by the table. It's a low force adjustment. It's very specific. There's no lateral flexion or rotation of the head. We don't do the stuff you see on TikTok or YouTube. And it helps them out a ton because of that stability through the adjustment and it being very specific of that bone that's necessary, that's holding her up, because of the x-rays that we shot. And it's helped out a ton. I'm going to have another story of another Ehlers-Danlos POTS case coming up pretty soon. But this one was powerful. She had a lot of stuff going on, and she's done great with care. And it's her body just being able to regulate itself. It's her body just not having, being able to kind of handle stressors, because her upper neck is in a much better place, which is where all the control centers for our body are located. And it's a super critical part, not just for all humans, but also especially people who deal with Ehlers-Danlos and POTS. That is where, if you got that going on, get that checked out ASAP. Get your nervous system tested ASAP. That is more than likely the root of a significant portion of your problems, particularly your health problems. I would get that checked out as quickly as possible. Find a doc near you who does that computerized infrared thermography, who shoots x-rays to figure out what that problem is unique to you, and start getting that upper area regulated, stabilized, and back to thriving. That is my POTS Ehlers-Danlos clinical case review, and I'm super grateful for that patient. She's awesome.